Good morning, everyone. I'm really happy to welcome you in today's webinar on engaging other sectors in Housing First. My name is Arturo Coego. I am the current acting coordinator for the Housing First Hub. I hope you had a pleasant start of the year. Probably some of you just came back from your holidays. I hope you're dealing with that the best you can. Just a few words about the Housing First Europe Hub for those who don't know us. The Hub is a partnership of organizations, housing providers, cities, governments, foundations, and others who have come together because we all think that Housing First is an important contributing factor to helping to prevent and end homelessness, starting with housing and supporting people's need and help to move our systems to a better approach to tackling homelessness. We are now almost 50 organizations across Europe and beyond, and our work focuses on research, advocacy, knowledge exchange, and capacity building. Today, actually, this webinar is one of those activities related to this knowledge exchange and capacity building. So we are very, very happy. We are so lucky to have Alex Smith with us today. Alex is a senior national practice development project manager at Homeless Link in the UK. Good morning, Alex. Thanks a lot for being with us today. She will present us why and how to work together with other sectors in Housing First. And after her presentation, we will have time for questions and answers. You can use the chat and the Q&A section in Zoom to ask your questions as we go along. So said this, thanks everyone for attending this webinar, and we can start right now. I'm just giving the floor to Alex. Ready when you are.
Thank you. Morning, everyone. Thanks for the introduction. So yeah, Alex from Homeless Link in England, lead our Housing First England work. And we've been doing quite a lot of thinking about this question of engaging other sectors in Housing First over the past year or so. I think primarily this presentation will focus on the kind of operational aspect of engaging other sectors, but maybe a little bit of thought about kind of more of the strategic thinking and where Housing First sits within the broader system. Just a little bit for anybody who isn't familiar with the organisation that I work for. So Homeless Link is a national membership charity for organisations working with people who become homeless in England. So our work is focused on practice development, research, policy and campaigning work. And we kind of describe ourselves as a second tier organisation. So we're not delivering direct services to people who are experiencing homelessness. We don't deliver any direct Housing First. So I think that's just important to understand that context. And the perspective that we have in our role within this is very much around supporting the delivery of Housing First in England. Again, a bit of context. I just think it's always interesting in these sessions when we're all from a very diverse range of countries and at different points on our journey with Housing First to just say a little bit about Housing First in England. We did some research in 2017 and repeated that research in 2020 to look at the picture of Housing First in England, just to see how we're kind of scaling up the level of Housing First provision that we have. That research from 2020 is now already over 3 years out of date. So these figures are still kind of changing all of the time, but the general idea is that we've seen over the past 10 plus years a steady increase to Housing First provision in England, going up from 32 services in 2017 to over 100 in 2020, serving around 2,000 people at any one time. I would say in the past 3 years, with additional investment from our government, that's probably gone up approximately about a third, so maybe around 150 services in England now, but we don't have kind of official data on that. It's just an estimate. So I hope that's useful in just giving a little bit of context to Housing First in England. So over that period, so since 2010, I think we started with our first Housing First service, we've learnt a lot about the challenges, about problem solving, and we've developed a lot of resources, guides and tools, and we've really been thinking, as I say, over the past year about this question of engaging other sectors. And I wanted to start by thinking about the group that access Housing First. And in England, we have a term of multiple disadvantage that we talk about. I don't know if that's a familiar term for others. But that diagram there just tries to kind of demonstrate that we're talking about people that have got a number of different and overlapping needs around, you know, their physical health, their mental health, drug and alcohol dependency, contact with the criminal justice system, and homelessness and unstable housing. But I think what we've really started to think about is that homelessness and unstable housing is really just one part of multiple disadvantage. But Housing First, particularly in England, I don't know if that's the same for others on the call, but Housing First is very much situated in the homelessness sector and is very much viewed as a response to rough sleeping. And I think that's led to maybe a bit of a lack of attention around those broader needs of the Housing First cohort, and also the role of other sectors in both the delivery and the impact that Housing First has on other sectors. So I think that's just a useful starting point, is really trying to ground this work in multiple disadvantage rather than necessarily in homelessness, although homelessness is obviously a significant part. On the right-hand side of the screen, that's just a definition of multiple disadvantage that we use in England. I think it's really useful, and we'll, I think, be able to share these slides afterwards if people want to have a look at that in a bit more detail. So thinking about kind of multiple disadvantage and thinking about the need really for the complexity of the need of the Housing First cohort, that we have to really work in partnership. It's not really an option. And we have a bit of a saying, I guess, that Housing First is not an island. It can't operate as an island. It can't be separated or not connected with the rest of the sector, and working together is really an essential part of delivering Housing First. There was some work done with an organisation delivering Housing First in London that kind of recommended that we should have an extra principle that says, you know, partnerships are one of the key ingredients of Housing First, because it can't exist on its own. And I think that's for a number of different reasons. I've just listed some of them here, but as I've said before, with that kind of complexity of need, that we have to work together in order to meet that complexity of need. That there is sector specialism that we need to tap into. We've got some Housing First provision in England that embed specialist workers within the organisation, but most of the time we're reliant on that sector specialism elsewhere to meet people's needs, and that's really important. There's a kind of phrase of two heads are better than one. You know, the Housing First team doesn't always have the answer. I think that the more people that we have involved. Sometimes that can get complicated. We've got lots of different opinions, but actually we need creativity and we need people to be invested in problem solving to be able to get the best outcomes for an individual. Accountability for actions. Again, I don't know if this is familiar to you, but certainly in England we can see that there's well, we have a phrase of passing the buck. So, you know, it's not our problem, like you deal with that over there, and it kind of loses the individual in the middle of that. And actually having a kind of really robust multi-agency approach and a commitment to working together allows people to kind of hold that accountability and do the right thing for that individual, which essentially leads to better outcomes for people. So I think the purpose of this slide is just to say that I think working together is an essential ingredient of Housing First for lots of different reasons. But there are lots of barriers to doing that, and these barriers may seem familiar. They might be maybe particular to an English context, and there might be other barriers that you experience. I've just kind of picked out some of the key ones that we see. And my box is just over the list, so I'm just going to move that over so I can see. So yeah, this idea of no standard practices, that there's quite a lot of inconsistency in the approaches that the Housing First team are taking compared to other sectors. And yeah, people are experiencing kind of different sets of expectations, different understanding of the individual, and it can create quite a lot of tensions, I think. We know, and I guess most people on the call are kind of going to be people involved in Housing First, that having a trauma-informed approach is key. But again, there can be tensions with other sectors around their understanding of trauma, the culture of having a trauma-informed care approach. Particularly, I think, with some sectors, maybe rather than others, there can be quite a punitive approach to dealing with what's seen as problematic behaviour that can really cause that tension. There can be stigma and prejudice, that I think a lack of understanding of the client group, of addiction, of multiple disadvantage, of thinking that, you know, I've got a long list of people that need to access this service, and the Housing First resident is maybe a very low priority because they're seen as not helping themselves, they're not engaging. And yeah, this idea of kind of deserving and undeserving of help and support. Some policies and procedures directly make it difficult to engage with other sectors. That something in particular that comes to mind is this idea of kind of a 3 strikes and you're out, so you don't attend 3 appointments and that's your case kind of closed, and you're kind of off the books of that service, and you've got to go through a whole kind of new referral process, which, you know, for people that are living very chaotic lives and dealing with multiple disadvantage, attending appointments can be really tricky, but that can create tensions with other services based on kind of the ways that they operate. And a lot of those ways that they operate are being born out of a lack of resources, a lack of capacity, very long waiting lists, and making the service more and more restricted in its flexibility because of a lack of resources, which directly creates that tension, I think, when trying to support people experiencing multiple disadvantage. So securing buy-in from these other sectors, again, I need to move my my box over so I can see. Should put all of these slides on the same side. About how I guess we can overcome some of these barriers and things that we've learned over the past 10 years in our Housing First delivery, and yeah, something that I've been exploring quite a lot over the past year, is really trying to situate ourselves in the shoes of those other sectors. So really trying to, I think, take a systems thinking approach and say, kind of, if I was a probation worker or if I was a GP, you know, take your pick, any example of that. But what would be my kind of perspective in that role of Housing First, and how do we articulate and frame Housing First in a way that will seem relevant to that individual in their role as a probation worker or a GP? I think this is a really important one of how does Housing First help me in my role? And that's really trying to explore that kind of mindset and getting to understand those other sectors, what their pushes and pulls are, their challenges, and trying to figure out a way of making Housing First relevant and useful rather than other and additional, in terms of, you know, more work to do. So for example, with criminal justice, a lot of the motivation is maybe around engaging with appointments. You know, if someone's on probation, they've got to meet that statutory requirement. How can Housing First help there? Reoffending is a big motivator, reducing reoffending. How can Housing First help there? From a health perspective, often, you know, we want people to be registered with a GP, having contact with their primary care service rather than accident and emergency, very expensive, kind of unplanned healthcare. Again, how can Housing First be relevant and useful from that perspective? And then that kind of leads on, and this is a question that's been kind of levelled at us a lot, is that a lot of the time when we're talking about how Housing First is relevant, how does it help, it's kind of based on a bit of hearsay or what we think, because a lot of the evidence for Housing First is often situated in the context of homelessness. And I think probably everyone on the call can quote figures around tenancy sustainment rates for their Housing First service, and it's not to detract from that, because obviously Housing First does a phenomenal job around reducing rough sleeping and homelessness and supporting somebody's ability to maintain their tenancy. But maybe what we're not so good at is articulating what are those other very strong impacts and benefits of Housing First to those other sectors. Where's the real evidence to do that? And we, in England, kind of embarked on a research project last year to try and explore that. So thinking about Housing First services that have been operating longer term and beyond tenancy sustainment, start to really unpick what kind of impact does Housing First have, and really try to both quantify that and qualify it in terms of the evidence base. That research is going to be published really soon. We'll absolutely share that with the Hub, and that can be shared with all of you, which I think it proves the hearsay in terms of, you know, Housing First has a significant impact on reducing reoffending, on somebody's mental health, on the number of safeguarding concerns that are raised, somebody's use of drug and alcohol. The trajectory is all positive the longer somebody is with Housing First. And I think we can be better at trying to get that evidence to the right people. And that kind of leads to maybe some more of that strategic thinking of how we engage other sectors, and how we can get maybe funding from other sectors for Housing First, as well as that operational buy-in to deliver Housing First in a more collaborative way. That evidence is obviously kind of based in terms of Housing First in England. I think it will be very relevant for others, but I would probably encourage you to think about kind of what your evidence base looks like for engaging other sectors and telling that story of the impact that Housing First has. And the final thing is that this has come up quite recently, but I think when you're in the world of Housing First, like, we're very attached to Housing First as a name, as a model. It's got a very strong identity, and it makes a lot of sense to us, you know, in terms of the ethos behind Housing First of being, you know, a human right and the kind of foundation and the starting point. But what we've heard is that the name Housing First can maybe be a bit isolating for other sectors. They hear housing and they think that's not for me, that's not my role, that's not relevant. So it's not necessarily about kind of changing the name, and it is absolutely the Housing First model, but there's maybe some thinking to do about how do we frame what Housing First is in a way that it does make it more relevant and maybe doesn't focus so much on housing and homelessness, but thinks about kind of the impacts that the model has for those other sectors. I think that's kind of it in terms of some of my thinking around the importance of working together in partnership, some of the barriers that we face, and then some of the buy-in. This is very much a kind of a starting point, I would say, and it's a journey that we started about a year ago. And we're still, you know, we've got that research coming out, and this year coming will very much be focusing on how do we put that into practice and try to use the work that we've done to move that conversation on. One of the big kind of drives for Housing First in England is to think about a national programme of Housing First that would be supported by multiple departments of government. At the moment, Housing First kind of sits within one team of government and is very much seen as a response to rough sleeping. And we would really love to be able to change that. But it's big kind of systems change work. And with any kind of systems change work, you've got to start somewhere. And we started last year thinking about kind of these questions of how do we secure buy-in, and what can we do from Homeless Link perspective to try and give services the tools to start those conversations. And we came up with this idea of having guides to Housing First for other sectors. So we have 5 of them. They're available on our website. I can pop a link in once I've finished talking. They are obviously based in an English context, so I think they would maybe need to be adapted for other countries, but I think that would be quite easy to do. And they're basically kind of conversation starters, really. They're trying to situate Housing First in the context of another sector, and thinking about kind of what's relevant, how does it help me, what's the evidence, and then hopefully that kind of leads on to maybe more work with the Housing First team. So I thought I'd maybe just briefly introduce those guides to you so you can have a look through. I'll kind of explain how we've laid them out. And then, yeah, I can post a link in so you can have a look at them. So we've got 5 of the guides. This is what they look like, and I'll go through each of the sections in a bit more detail. But we've got one for criminal justice professionals. We've got one for substance misuse professionals. We have one for mental health professionals, one for physical health professionals, and then one for social care professionals. It's not to say that they're the only 5 sectors that matter, but they're the 5 that we kind of initially focused on, that we thought were the most relevant. And we've described these as kind of 7-minute briefings. And the idea is that they're supposed to be short and sharp, snappy, recognizing that, you know, that people don't have a lot of time to be reading this stuff, and that we just kind of want to get a hook basically to get people interested in Housing First. So all 5 of the guides kind of follow this same pattern of 7 sections. Some of them are the same in each of the guides, some of them are adapted to make it more relevant to that particular sector. So we've got the first section of what Housing First is, and again, that's just a kind of brief description, but with additional links so people can get further information and more detail if they want to about kind of the principles. We've got an animation which demonstrates kind of a story of how Housing First works. That's the same on all 5 of them. The context section, that changes on each of the guides, so that's really trying to situate Housing First in relation to that sector. So why is it relevant to a criminal justice professional? What impact does it have? What evidence do we have to try and show the importance of Housing First to the work that you do? And yeah, trying to kind of make the case really about why Housing First is relevant. The third section is the same in all of them. So this is just the definition that I had up earlier around what multiple disadvantage is. And again, trying to just expand away from it being seen as just a homelessness intervention and thinking about the broader needs of the group that it's targeting. The fourth section is about housing first in your role. So again, this is very tailored for each of them, and thinking in this case, kind of what as a criminal justice professional, what's your role in supporting Housing First, working with the Housing First team? How can it benefit you in the work that you're doing? So just some kind of practical examples of that. The fifth section is more of a kind of practical creating contact with the Housing First service. So the Housing First service could put their details on here. So there's kind of a point of contact. If the referrals are open, it could be a way of trying to attract referrals from other sectors to engage with people that they're working with that would maybe benefit from Housing First. The sixth section, again, is the same in all of them. And that's trying to draw in some of the principles and thinking about kind of that question of one of the barriers of people having no consistency in their approaches is trying to really highlight, and it's not a lot of detail, we've got some additional links so people can get more detail, but it's just trying to kind of put those three main approaches in people's awareness. So being aware of trauma-informed care, strengths-based practice, harm reduction, and trying to get a bit of consistency in the approaches between different sectors. And the seventh section, the seventh step in all of these guides is kind of the call to action. So you've heard a bit about Housing First, maybe it sounds a bit interesting, maybe you want to do a bit more. This is kind of our advice really about kind of sharing with your colleagues to kind of build the profile of Housing First within your organisation, connecting with your local Housing First service, and then trying to build some of those partnerships, either kind of formally through maybe what we have in England are kind of service level agreements, and formalising the partnerships. Sometimes that's not possible, so it's maybe informal, kind of agreeing a point of contact. So there's something kind of beyond just, oh, Housing First sounds interesting, and we'll take it a bit further. So yeah, we've had those guides up on the website for just over 6 months, maybe a little bit longer. So it's hard to know yet kind of how they're being used or what kind of impact they're having. But I thought it would be useful to share. And as I say, kind of very happy for others to use them or to adapt them if that would be useful for your service. I think I said I would speak for about half an hour or two. I think I'm about done on the slides. I've got we've got time for questions, and they're my contact details if anybody wants to get in touch.
Thanks a lot, Alex, for your words and for these amazing guides. To be honest, it is a great work you've done in Homeless Link. We are seeing already good feedback in the chat. And I would like to encourage our audience to participate through the Q&A box in the low bar in the Zoom application. I wanted to ask you, well, to start facilitating the debate by asking you how technology and innovation can be facilitators to enhance engagement between Housing First services and other sectors. Do you think of any ways it can be a facilitator to make these matches happen?
Interesting. Have you got any examples what you're thinking of?
I'm just thinking, for example, and lately we're seeing a lot of news about artificial intelligence or I don't know, new ways of technology, and I was just curious about. This is a question also for all the audience, if someone has any idea. And also, we had a very similar session about this topic on the symposium, which is a space where all of the students of the Train the Trainers course that the Housing First Hub delivers every year. The symposium is this space where all the students or former students are actually meeting and gathering for sparking innovation and try to think new ideas, etc., which I think is very exciting. And since connecting Housing First with other sectors is already innovative, because maybe sometimes in the third sector we're kind of just working in our thing and by our rules, and sometimes, and this is why probably your guides are so successful, because it opens our mind, it makes us think out of the box. I was wondering if there is any tech facilitator, or maybe I don't know, maybe it can be LinkedIn, having a group on LinkedIn, or where several sectors just cross and talk about innovation and homelessness. I don't know, just open
Yeah,
the conversation.
interesting. I would say that actually my experience of technology is that it could probably be added to that barriers list, in that all of those different sectors are often using different systems. Those systems are, you know, very difficult to integrate and to share information. I think that becomes a real challenge about who's got access to what system, who's got access to what information, who's got consent to have what kind of information. And yeah, I don't know if we've quite cracked that, to be honest. I think not so much around technology, but I think examples that we've seen in England of kind of putting this into practice is using sort of templates that everybody can buy into. So there's something called the Team Around Me, that a service developed in England that is trying to centre the individual in a multi-agency meeting, but creating a template that everybody who's kind of signed up to that multi-agency meeting is all feeding into. So there's a level of kind of consistency. I don't think it's a Word document, so it's probably not technically sort of tapping into lots of different creativity, but I think something about trying to create that consistency in approach, and there are probably technological ways to do that, but I don't know if we're very good at doing that, to be honest.
Yeah, thanks for your answer. I was also thinking, because sometimes when we talk about Housing First in other congresses or other occasions, sometimes Housing First principles, Housing First core principles can be shocking or surprising. How is your experience dealing with other sectors in relation with the Housing First principles? Do you think people embrace them, or do you actually notice any reluctance or any resistance to understand, for example, right to housing, or the person-centered approach, where the actual tenant decides where he wants to go?
Yeah, I think it depends, and this is where it does get quite tricky, because we're talking today about engaging with other sectors as though other sectors are one kind of homogenous group, and it is incredibly diverse, and people's kind of response to Housing First principles, I think, will be and is very different based on kind of their role. So, for example, a social worker would be very familiar with the concept of person-centered working, but maybe a probation officer, that's not something that's so kind of obvious to their work. So I think that this is one of the tricky things about engaging with other sectors, is that we've got to be really, really flexible. And I think kind of putting yourself, that kind of point that I made in the presentation, of putting yourself in the shoes of those other workers and trying to get into the mindset of where they're at within their work, I think their response to Housing First can probably give you quite a lot of insight about whether or not they have an understanding. I think sometimes people will say, like, that sounds amazing, that's exactly what's needed, that this is what we've been looking for. Other people, skeptical. And I think on that point of kind of scarcity of resource, and in England, as in a lot of places, we have a housing crisis. We don't have enough social housing for anybody, let alone for people on Housing First. So there can be this almost kind of, question of prioritization. Should Housing First people be given priority for housing over, a parent and child, for example, who are waiting for permanent housing, who are, stuck in the temporary housing system. And I think that can be a bit of a tension about, oh, well, it's great in practice, but in reality, how does that like how do you prioritize one group over another? And I think, yeah, that can be quite a challenge.
Thanks, Alex. So we have, I think, two more questions. There is one in the chat by Pierre Blundell. He says, hello, and thank you for your presentation. Recovery is cited as one of the main tools or goals of the French Housing First national program, as well as harm reduction. He's wondering why you did not mention it, and if this approach is used by Housing First teams in the UK.
Yeah, we do have a slightly different set of principles. We've got 7 Housing First principles for England that don't specifically focus on recovery. I think in the development kind of a long time ago now, it was felt that we have kind of recovery is something that is fairly well known and integral to services anyway. So it didn't feel like it was a separate principle in the way that a harm reduction approach is. But yeah, it's interesting, I think, that that you've described that as a main goal. Yeah, we don't really describe goals, I would say, within our principles. The more, ways of working, I think, for the Housing First service. And we just wouldn't have recovery as a specific goal, although it's kind of threaded through, I think, the other principles.
Thanks. We have another question in the Q&A box. Anna Lilj Flagberbaum, not green, says, do you primarily apply the cross-sectoral approach on local or national level? And also a second question, are partnerships on national level key for getting to cross-sectoral partnerships on local level?
Yeah, that's a really good question. And I think these guides were primarily developed at a kind of local operational level. So thinking about individual Housing First teams and their relationships with those other sectors within the delivery of that service. But it is part of a broader piece of work that I think we need kind of that bottom up and top down approach to cross departmental working. We've kind of started, I think, with that focus on operational, but with the research and with the work that we're going to be doing this year, it's really trying to think about from a policy perspective, how we can build in this cross-departmental working to Housing First, and to essentially, because I mean, in England, where we're at the moment, all of the funding for Housing First sits within one department of government. And that funding is all due to end in 2025, which scarily that is now next year, because we're now in 2024. And beyond 2025, there is no plan about how Housing First provision will be funded and how it will continue. So within that, there is a lot of uncertainty and a bit of fear about what will happen, both to the people that are currently being supported, but what the future of Housing First looks like in England. But I think on the other side of that, there is lots of opportunity as well about how we shape kind of what we've learned into the next kind of steps and the next phase for Housing First. So we're really hopeful that that research, so probably not so much the guides, but the guides I think are always useful just to those hooks to kind of get people interested and give them a bit of information. But I think more so the research and building the evidence base to be thinking about those kind of strategic national conversations with government, and getting people bought into Housing First who are maybe still thinking of it as a homelessness intervention. So yeah, on both levels, I would say, but those guides primarily kind of at a local, more operational level.
Thanks, Alex. I wanted to ask you as well, what's the feedback you're getting from these guides? Because I find them very interesting. I know it's a work that's been done for some time now, and I was wondering if in this time you think about new ideas, how to improve them or to take them to the next level. I don't know, I'm just asking, what kind of feedback did you get, and if this is something to keep working on or not?
Yeah, I definitely think it's something to keep working on. And the evidence that we had before we did this research was quite limited, really. A lot of that evidence was based on other research, not research from England, which makes it a bit tricky, I think, in terms of getting that buy-in to think of how is this relevant to our work. So I think we definitely will update them with the new research. And yeah, I think in terms of feedback, so they were very co-produced with Housing First teams to think about kind of how they would work. They went through lots of different drafts. And I think, yeah, generally positive feedback, but it's still, I think, fairly early days that we need to maybe think about how they're being used and developed.
Well, that's promising. When we sent out this invitation for the webinar, we asked people if they had some questions in advance. I think some of them were already addressed, and I see that there are other questions that maybe we are in an early stage to answer. For example, how do you get formal agreements written into legislation with other sectors and services? So maybe it's to a specific question, but I don't know if you have any experience on this about how to take informal agreements into some more established and relationships. Don't know if you want any comment on that.
Yeah, I mean that is a big challenge. I think sometimes where we've seen kind of positive partnerships, it's very kind of relationship dependent. It's kind of one individual that has had a kind of interest or a motivation, and then if they move roles, and things kind of it's not very secure. I think it falls apart quite easily. So I think there's got to be beyond kind of individual relationships. There's got to be continual work, I think, around kind of building more of an understanding across the organisation and kind of those cultural shifts that are needed around kind of trauma-informed approaches. Thinking about how the Housing First team can try and kind of, if you've got a foot in the door and you've kind of got a bit of interest, like how do we build on that? And that might be creating more formal agreements. So as I said, I think like there's something called service level agreements that we have that would kind of detail sort of formal expectations from each of the partners, and in terms of either engaging in a kind of standard meeting to discuss Housing First residents, or lots of different options, but kind of formalizing that in agreement that's signed and that kind of can stand the test of people moving roles, and it's kind of more built in. And I think in others there's maybe opportunities to explore around kind of secondment arrangements. So I think we've seen a bit more of that in England, of maybe a drug and alcohol worker, for example, kind of being seconded into the Housing First team. So they'll work in the Housing First team. If that's not possible in terms of funding, then just co-locating teams can be really beneficial. So having the Housing First worker go and work in the drug and alcohol office to kind of just get to know each other better, or having a mental health worker come work with the Housing First team, building kind of those connections, and creating just a sense of that we're kind of a collective team around the individual, rather than we're lots of separate teams that are doing lots of separate things that sometimes aren't very helpful and at odds with each other. So yeah, I think there's probably, and you know, it will depend on the context and the different services, but yeah, there's probably different levels of building those partnerships, right through from kind of just informal, we're going to try our best to work together, through to kind of, you know, secondment arrangements and kind of, you know, sharing funding, and creating a very robust kind of multi-agency team for Housing First residents.
Thanks, Alice. I think we have only room for one more question, but maybe it's a double question. So one of them will be how involving other sectors can help in systems change for Housing First, and also if there is already any example of new fundings thanks to other sectors.
Yes, I mean, I would argue that involving other sectors in Housing First is kind of an act of systems change in itself, really. If we're kind of exposing people to different ways of thinking, of different philosophies, different approaches, trying to just shift practice, as well as shifting policy. I think, yeah, that's integral, really, and feels, you know, as much as part of a systems change to think about housing as a human right as it does to thinking about multiple disadvantage as everybody's business, and that actually to support somebody away from homelessness is to also meet their mental health needs and their physical health needs, and that we all need to work together in order to do that. So I think having those kind of shared outcomes and shared investment in an individual is crucial. That, yeah, it's not about, you know, oh, we've solved homelessness over here, and that's kind of isolated from somebody's mental health over here. Is trying to break down the connections, really, and how we can see it as more of a collective effort. And I've forgotten the second part of the question.
It's funny, yeah. The second part of the question was about if there is any new money thanks to other sectors.
Yeah, I would say that is really limited. We've, you know, despite kind of some of the amazing evidence that there is around the impact, I don't think there's been a huge amount of success of securing funding from other sectors. But that's something that we really want to focus on this year. There are pockets of it in England where we've had kind of a bit of health funding to support Housing First, but very, very limited, I'd say.
Well, maybe in the future it's a good topic to explore and bring new webinars on this and how to actually find paths towards other sectors in order to make fruitful partnerships in order to end homelessness. But we'll see that in the future. So Alex Smith, I don't want to steal more time from you, but I wanted to thank your participation today, and hopefully we can see you soon in next events.
Lovely. Thank you very much, everyone. Good to be here.
And to our audience, thank you for being with us today. In the last months, we were working hard on our website and on our YouTube channel. You can find this webinar on our YouTube channel during the next days, but you actually can find now the highlights from other webinars as well. So feel free to have a look and send us any feedback, like, subscribe, etc. So I want to wish you a very great week. And of course, since we're just starting 2024, wishing you a very nice and fruitful year. Thank you very much. Bye-bye.